Hello and welcome in nursing webinar session. Myself Shanti, and we are going to talk about pediatric safety and few tips for summer season. Still, we have a couple of months to beat the heat. So, having said so, let me welcome Dr. V. Ramesh Garu, who is our HOD, senior consultant, and very renowned pediatrics and neonatologist from Secunderabad, the Yashoda unit. I welcome you, sir.
Very good to all of you.
Thank you, sir. And let me also welcome the dynamic Harshitha Reddy, who is our senior nurse from PICU unit from Somajiguda Yashoda Hospital.
Thank you, ma'am.
Having said so, let us just see the slides now. As we are going to talk about the summer safety tips. So, sir, here we wish to understand from your point of view, like, could you highlight a few prevalent pediatric summer conditions or any kind of emerging trends which we are witnessing in your OPD, sir?
Yeah, actually, to be very concerned, actually, when compared to the last 10 years, this summer is really very, very hot. We had had temperatures in Hyderabad going up to 43, 44. So, like the old days, because now the mothers have become very smart and they look after the children well, and they are giving very safe water. Even the very low income people also, they give mineral water and safe water. We are not getting admissible cases so badly as is to be get about 10 or 15 years back. But still a lot of children, because in summer they take these mini holidays, we are getting cases of this sunburns or this heat strokes, gastroenteritis and all that. We'll be slowly talking as the session goes on.
Yes.
So we are getting cases, but basically, especially in the little lower income group who don't have air conditioning, the small babies are really very badly hit. The ones, especially the chubby toddlers we call, so the age groups between 6 months and 1.5 years, they just cannot tolerate heat.
So let us also understand what we have in the rest of the session. Harshita, you can take over.
Yeah.
Now we'll see the heat wave hazards, that what kind of problems and health related illnesses we are going to face through heat. Most of the time toddlers and preschoolers and school age kids are more prominent to get these heat related illnesses because they used to play in the sun and these kind of things we will see. So sweating may cause loss of body fluids, so which can leads to dehydration. So adequate hydration is very important for the children, and light clothing also we have to prefer, like providing full covering body, full body should be covered by cloths, and light colored cloths also we have to give to the children. Signs and symptoms of dehydration, as we have seen in ICUs and wards, whenever receiving the child, headache, fever, dark color urination will be there, and also irritability we can see in these kind of children's.
So, sir, how significant when we are talking about the heat and we are talking about the groups like toddler, infants, and all, how significant is the dehydration in among the pediatric patients, and how critical it can be if at all it is not treated?
Dehydration is one of the major causes of death in children, actually, especially in the village background, as saying. So, a very smart mother and a very smart sister should know the early to the bad signs of dehydration. In fact, Ms. Harshitha Reddy has a very smartly put all the major things: headache, fever, dark urine, irritability. But what are the mother, for example, the mother has gone outside for a shopping or something with her little baby outside. What are the first sign of dehydration? First sign is the child will become irritable. They'll just be crying, because that's the first part. Once the water levels go down, the child will become irritable. And after irritation, next they will, what is the bad sign is, they will start talking incoherently. The talk and the saying what is the concern, till now the baby will be absolutely fine. Suddenly they will start talking nonsense. That's a bad sign. So these are irritation, bad this thing, and getting a little groggy. Then if they are going into drowsy spells or this thing, then that's a bad sign. And if you touch the child and see if it's a very high fever, that's a very bad sign. And now how are you going to recognize whether the child is really having this thing? So very shortly, very briefly, I'll just go from head to foot. First, you look at the eyes. The first fluids which are going to get reduced in the body when there is severe dehydration is the tear fluid.
Yes.
So once the tear fluid goes down, the child who normally keeps on blinking the eyes, they'll stop blinking. It's called snake stain. Snakes don't blink, I think, all because they don't have eyelids. So the child will look like a snake, means he will always keep keeping around. So once the child is not blinking, immediately the sister must go into an alert and inform the doctor. Nowadays the sisters are so smart. They themselves will start the fluids before the doctor comes also. So that is the first sign. Then the mouth becomes very, very dry. The child keeps on trying to push the tongue out because they don't have any spit in the mouth. There is a salivary fluid because of lack of fluids. Then you get all the classical signs of dehydration. That is, we try to pinch the skin and this remains like that. That's called the tenting sign. The skin remains like a tent. So the other signs will come up. So these are the signs of recognizing the signs of dehydration is very, very smart for a, I'm not talking about a sister to the level of Dr. Harshitha, but for a new sister to pick up the signs of dehydration and immediately inform the doctor.
I think very well you have explained, sir. I think every NICU or pediatric nurse must have the neonatal or pediatric assessment.
No, this, I'm sorry to interrupt you, ma'am. This NICU and PS sisters, they'll pick up any small, even the minor things. But the ones in the ER, emergency room, or when the child is first brought up, picking up the bad signs of dehydration is very important for the very young nurse, especially.
Yeah.
And now we will see the heat effects. Means because of excessive heat or extreme heat, what kind of effects we will see in the children. Heat rashes and exhaustion will be more common, and also heat strokes. These are very commonly we will see. If we are not treating, it will become fatal. So close observation and monitoring is mandatory. If needed, hospitalization is also very important. And if we are hospitalizing, role of IV fluids will be more and more, because the baby is dehydrated and we have to replace the fluids as soon as possible. After that, assessing vitals is also important, and IO chart monitoring, how much intake they are taking and how much output we are getting, that monitoring should be there. In homes means we have to make the children to stay inside when the temperatures are more outside.
So, sir, due to this scorching heat, what age groups are you getting in your OPD, or and how crucial?
We get all the three categories. For
Okay.
example, the infants, because the houses are very hot, and as you know, the infants have got a very large surface area.
Yes.
Infants, the surface area when compared to the body, when we give the surface area ratio when compared to an adult, and the infants are very large surface area, and they have a lot of subcutaneous fat. So that the sweating levels are very, very high in an infant. So due to that, even babies who are there at home, for those unfortunate people, the lower middle class who don't have air conditioning, they keep losing lots of water and they'll become very irritable. So they generally, they are brought to us not for bad things, but saying that they are excessively crying. So what to do? We have to just convince the mother to give more fluids and tell the mother that we are also crying because of the heat. Convince her, because the baby is not going to stop. Because even after going back, again, the same heat, the same loss, and the water will be there. The next group is the 5 to 7 years group. These are the people who play in the corridors, or if they are staying in the flats, they'll be playing, and they are really exposed to the real heat. Yes. And the next category is the so-called the 10 to 15 years who play sports in summer. They'll go outside and play cricket or football, and they are very badly hit this summer. So all three they come to us.
Yes, yes.
In some form or other, unless they are very sick because of the severe heat also.
And sir, when we are talking about the management, what crucial role the nurses should monitor, like Harshita was mentioning, IO chart and giving the fluids and identifying the symptoms, consoling the mother and parents as well.
In the management, very, very important, two very important things I would like all the nursing staff to keep in mind is, for example, a bad child, because always first they come to the emergency room. The mother has brought the child to the emergency room. So first year, it's not the question of dehydration. Yeah. In any sunstroke, the first thing which has to be tackled is the very high temperature. Normally, sometimes the temperatures go up to 105, 106, 107 also sometimes, which is not compatible with life. They get brain damage because of the severe heat. So previously, nowadays, because I'm in pediatrics from 43 years now. So when we were saying at that time, they used to have in emergency rooms a thing called ice tubs. Yeah. Ice tubs. So they used to keep ice and ice cold water in summer. The minute the child is brought, they used to just dip him in the ice tub. Such a thing. But nowadays they ask us to spray water, cold water, or just pour the water after removing the clothes, because the skin should have more oxygenation. So once the clothes are removed, the oxygen breathing, because the skin also breathes oxygen. So along with that, if you pour water, the temperature should come down Never give paracetamol as IV or oral when the child is brought with sunstroke, because paracetamol, as you know, it causes vasodilatation and more heat is saying. So first you bring it down by sponging or putting him in an ice tub. That is the first most important precaution. We cannot expect a very severe sunstroke child. We cannot ask the mother to keep giving water, because invariably he'll throw up.
Yes.
You give this much water, he'll throw up this much. So the water loss. So don't give him any essay, and immediately depending upon the condition and depending upon the electrolyte imbalance, what type of, if he has more amount of vomiting, we start him immediately on normal saline, because we lose more HCl. But if the child is purging also along with that, then a more balanced fluid like isolate P or something like that we will generally give.
So the current treatment of nursing care and fashion to cool the children's are like keep it sponge with cold water.
Exactly.
And
First, bring down the temperature rapidly.
Yes. Yeah. Yeah, Harshitha.
Because that can cause brain damage, which is irreversible.
Yes.
All other things can be corrected.
Yes. Yeah, Harshitha.
Protect the harmful children from harmful UV rays. Like we can use the sunglasses and limit the sun exposure to the children, and also we can use the sunscreen lotions for the babies also, because we can use that SPF more than 30 to 50 we can use for children's, and we have to give more hydration to the children, that we have to follow it. And parents must escort. Supervision is mandatory when the children are at home, and our outdoor excursions should be planned early morning or late evening. These things we have to follow to protect the children from harmful UV rays.
So, sir, are these precautionary measures, enough to be followed? Because kids, they don't listen to the parents. Sometimes they just run for the play.
The points Ms. Harshitha has brought but perfectly covers the thing. I don't think there is anything for me to add in that. But normally, one small thing, more than patients, because I see with my grandchildren when we go out, when I take them out to a holiday, is the sunscreen usage. Always tell the mother not to put the sunscreen at least about for at least a half a centimeter from the eyes. Sunscreen, whenever you use sunscreen, you tend to sweat more on the face. So children, they will rub it down. If sunscreen goes into the eyes, your whole that half day of sightseeing is finished. They'll be crying. The eye will become red. So see that the sunscreen does not get into the eyes. That precaution has to be taken. The rest of the things are all very beautifully written.
Yes.
There's nothing for me to add.
Next, whenever summer means, as we all knows that children will run into the pools. So water safety measures is mandatory for all the parents. Here the parents will play a major role, because they only will be there with the children. So constant supervision is mandatory by the parents, because there is a chance of getting drowning. Drowning is very fatal. We all knows about the drowning. So in summer we used to get so many cases, so many drowning cases into ICUs. I also have seen. And the new swimmers who are going to the pools, they should be accompanied by the trainer or the parents. And swimming accessories is also important to the children, because it will helpful to prevent the drowning also.
So, sir, here when I was talking to Harshitha yesterday, or she was just mentioning that the common infections which children they are coming to the hospital is due to due to the water, infected water or stagnant pool. Because in the city water is managed well, but in the rural setup it is stagnated, small ponds and very badly managed pool. So, what are the common infections where these kids coming to the ER or to your OPD with the kind of infection?
I would slightly differ with you by saying that in city the water is managed very well. It is not, ma'am.
Yes.
I'm sorry. In fact, we are having an acute water shortage, and we are getting a lot of cases, because all children, generally the mothers, they like them to learn swimming, so they join them in swimming pools, and the swimming pools are so overloaded. In fact, we doctors sometimes we call the swimming pool water like a microbiologist's delight. You have any organism, you can pick it out from that.
Yes.
So bad the water is, because they don't change the water very frequently because of the acute shorter wattage. And over that, they keep on adding chlorine. So there are two complications for children who are swimming in regular swimming pools, which the way there's no continuous water change. Some of these 5-star pools and all that, they have water change, but that the 95% of the people don't have access to that sort of pools. So here, due to that chlorine, what happens is your eyes start burning. And if it gets into the mouth, sometimes a child, unless he's an expert, suddenly he may take the water into his nose, and it will cause this thing and cause severe rhinitis.
Yeah.
And if they swallow, they have all because small children, they pass urine in the thing, they'll be continuously spitting. So at least out of the 10 children, you have 1 or 2 children may have to be carrying some virus. So the water is all contaminated. So there's a very high chance of the child catching some infection. We leave on the drowning part. The drowning also just recently, 2-3 days back, we had a drowning case here. But that is a real bad luck. But nowadays, majority of the pools are manned by a professional who will be standing there. So this is regarding the city pools. Either you get infection or you have this eye complications or nose complications because of the high chlorine content in the water. They don't change the water, but they keep on adding chlorine so that the water, they think that it will knock out the bacteria.
Yes.
But I'm talking about the other thing.
Yes.
For example, the parents have taken them out to a small farmhouse which has got a big, small, which is near to a small river or near to a small lake. Or sometimes in the villages, they have very big wells.
Yes.
They are called bavulu. Means they normally swim. They have got very, very big wells. Those are very dangerous because these wells, they have a small algae which are called diatoms. So generally from the villages, children who swim in this village wells, the diatoms, if they even once or twice it goes into the system, they cause a very severe complication called bronchiectasis. It's a irreversible complication.
Yes. Yes.
Initially, it will start with cough, and those algae, they multiply inside the lungs and causes. There's plenty of other things because there's wells could be having small tadpoles which can enter into your ears and cause a chronic ear infection. So multiple problems this way or that way. But as drowning is the most important thing, as she rightly pointed out, we should always have we cannot leave children without without an attendant.
So we acknowledge your guidance on few learning, terminologies. I am learning like snake stare, diatoms, and your all these kind of terminologies which we are enjoying now. Yes. Yeah. Harshitha.
Now we'll see that foodborne infections, because summer means everyone will go for vacations, picnics, parties everywhere. So because of food change and climate change and water change, everyone, so many of people will face that foodborne illnesses like food poisoning, these kind of things. To prevent that, we have to maintain picnic safety, and also food handling is very important. Need to, as much as possible, we have to avoid intake of outside foods, and we have to prevent the cross contamination. Safe drinking water access also is mandatory whenever going with the babies outside. Then they better to carry water bottles. And also be vigilant for the symptoms such as like nausea, vomiting, pain abdomen, fever, diarrhea. And if it is severe, need to seek medical attention, or need to consult a doctor is mandatory.
Sir, at current now foodborne illnesses among children, I think you would like to tell us a few.
Yeah, normally foodborne infection in summer, we have more and more of this water and foodborne infections. Water nowadays, 90% of the people are very, very careful, ma'am. Even the very, very low income people also, when they go out, they are drinking mineral water. That's a very good sign for our country. Means that so much we have educated the people not to drink water. They take either water along or they take mineral water. But still, all the same, as I was telling you, the child can suddenly, due to swimming, or is saying you can go, or sometimes he can get a water which is supposed to be a mineral water, but that local fellow has filled it in that and sealed it. So we cannot say. But all the same, in summer, these waterborne infections like cholera, gastroenteritis, then typhoid, and sometimes even severe jaundice, which are hepatitis A, they are quite common in summer. But coming to the food, summer is very, very important. If you go for a picnic, I would advise them not to take non-vegetarian food. As we all know, meat quickly gets denatured with heat. Any meat product. The only vegetarian product which can very rapidly, I think you all know what is denatured. Yes. Quickly it will get spoiled and bacteria will form in that, and sometimes you'll get very, very severe staphylococcal poisoning with eating meat which is left outside, because when you're going on a picnic, you're outdoor and it's going to be very, very hot. So the meat can get rancid. So in that you can develop staphylococcus, or all sorts of germs will grow, and you'll suddenly end up with passing 100 motions or something like that. You know what is staphylococcal food poisoning? So food poisoning is very common if you take non-vegetarian food and if it is not consumed within 1.5 to 2 hours after cooking, which is not possible when you take for your picnic. You cook some biryani in the morning and you pack it up and eat it in the afternoon, and by evening you'll be back in the hospital. So try to, and generally we must tell people not to take non-vegetarian food. And paneer is I think you know what is paneer.
Yes.
I think they call it cotton cheese. I think.
Yes, cotton
cheese also very quickly denaturalizes in summer. So these are two things to be avoided. Then rest all the thing, I think the hygiene and the water and the washing our hands already, Ms. Harshitha has already, I think.
Yes. And they mostly can carry the juices, fruits, all.
Oh yes, those are very safe, and those really we can enjoy in summer also.
Yeah.
Our people generally take biryani along.
Yes.
Hyderabad is.
Yes.
And now we will see the heat-related illnesses and how we have to cope up with that. Most of the common heat-related illnesses are ear infections, dehydration, high fever spikes, and hepatitis A we can see. Gastroenteritis is more and more common. Insect bites also when they are playing outside. And for this, what kind of care we have to provide if we are seeing antipyretic administration we can do if fever spikes are there. If we can't get IV line access, then we can go for rectal suppositories. Analgesics we can provide. If baby is too dehydrated, we can go for IV fluid boluses also, like a 0.9% NS bolus we can give. For maintaining electrolyte balance, we can go with KCl, adding in that potassium chloride we can add in the fluid whatever we are giving to the children. And if babies is having any skin rashes and skin related illnesses, we can go for the topical antibiotic applications, and antihistamines also we can give.
So any other important interventions? As you see, we infuse KCl, and KCl is one of the high risk medication along with the electrolytes. Any other symptoms or interventions which nurses should adhere to, sir?
This quite, in fact, is very rightly said. That's the reason why we advise this tender coconut water whenever you go outside, because tender coconut water, is very rich in KCl. So the child, if it's in the initial stage, they can prevent this, because KCl, if you give an IV, you have to carefully monitor. You just cannot give like that. I think this should be good enough. Yes. So it all depends. The initial assessment is whether the child is only vomiting or whether the child has got gastroenteritis. So if the child has got enteritis, then that is loose motions. Loose motions are not very the dehydration will be more even. If it's only severe vomiting, then the child may not require so much of KCl because there's mainly loss of HCLs.
Yeah.
But giving a bolus is very, very important. I'm sorry. That's very important, because that little time saving, the child should not go into a renal shutdown. So giving the bolus is very, very important. Very important. Because the kidney requires constant water and for circulation, because that's the first organ to get shut down once you're going for dehydration. By giving a bolus, you're definitely going to save the kidney.
Then the role of parents when the children will be at home, what kind of care they have to focus means handling summer injuries at home only. And when the child starts having loose stools or vomitings, then immediately they have to take attention towards the children, and they have to take minor treatment like the thing in the home only. And they should not use any OTC medications at home, and they have to encourage the children to take plenty of fluids. It's mandatory to encourage that to the children.
So a few essentials should be kept in mind when we talk about this ORS, hydration to the parents to be given to the children. So what are the few essentials we all should keep in mind, sir?
Essentials. So ORS normally is now very, very much encouraged. But ORS, the problem is if it's given in summer, if it's given during diarrhea, if it is given during vomitings, it's okay. But ORS, a lot of mothers nowadays, they are misusing it to such an extent. Why mothers, even some adults, they think that ORS is strength giving. Yes. A lot of old, especially after a certain age. For example, if I keep taking ORS, exactly in 1 month, I'll end up with a complete renal shutdown, because you're taking excess salt into the body. So the importance of ORS should be given. ORS should be only given when you think there could be a loss of salts and water from the body. It's not a routine tonic or something which every day this thing should be taken. And nowadays we got plenty and plenty types of ORS. And if they can afford it, it's always better you take the liquid form, because by reconstitution, sometimes they can always make a mistake and they can make it a little less diluted or over diluted. Both are dangerous again for the child if it's not exactly diluted properly.
So I think we have come to the end of the session. Next slide. And yes, as you have highlighted about many points, like just giving ORS is not the solution unless until child has the signs and symptoms of dehydration. Yes, supervision, education, and preparation to mitigate the risk associated with this heat season is very important. That's how we want and request all the parents to just apply these a few safety points. And any conclusion, a note for nurses handling these cases from your end?
Normally, I think what all we have covered is saying is some few points which I told you is very important.
Yes.
Technically, I think as I always keep telling, whether it's a dehydration or a complicated cardiothoracic surgery, it is totally you members of the most noble profession who are really going to manage the child. We doctors come and give some instructions and go. So it's you people who are going to really save the child or the adult or whatever it is.
Yes.
So that technical aspects and the more scientific part, I think is beyond the scope of this particular webinar. But the few points when you know that he's dehydrated and when the temperature has to be brought down with sponging instead of giving medication and all that, I think we already talked. I think that should be good enough. Another small point I just wanted to tell you, because you actually come across more people than a doctor, because you'll be able to educate people much better than us is. Nowadays, everybody is having this air coolers.
Air coolers, yeah.
Air coolers. I'm not talking about the air conditioner. I think luckily, at least the three of us are blessed to, we are always in a place where we got air conditioners.
Yes, sir.
These air coolers are very, very dangerous for children. Very, very dangerous. For example, if it's slightly drizzling outside, will we put a bed outside and put the baby there to sleep? We are not going to do that. Air cooler is exactly that. It's a small rain. So they put a fan in the back and they sprinkle water in front of the fan, and that will be spraying water on you. That's why summer we get sometimes we are getting a lot of pneumonias now. And if you take a history, 90% of them are sleeping in bedrooms which are air cooled. So that I just wanted to put that point to you. If you at all you suspect why is he getting cold, it's very rare to have cold and cough unless he either swims or sleeps under the air cool.
So very valuable point you have told us, sir. We will definitely, the learners and viewers must, give the awareness to the parents as well. And I think Nurses Day falls on May 12th, and Yashoda Hospital wishes everybody happy Nurses Day.
Slightly interrupting you, and wish you all a very, very, very happy International Nurses Day.
Yes. Yes, Yashoda Hospital wishes everybody a very happy Nurses Day. Your care and contribution to the healthcare system is priceless. So we end the session, and thank you, sir, and thank you, Harshitha.
Thank you, ma'am.